Okay, what is the following? Which of the following is the best next step in management of this patient? A 29-year-old woman presents to the clinic with complaints of severe pelvic pain during her menstrual periods and pain during intercourse. She also mentions that she and her partner have been unsuccessfully trying to conceive for the past 18 months. On physical examination, the physician notes a tender, immobile mass in the right adnexal region. Um, Transvaginal ultrasound reveals a complex cystic mass in the right ovary. Okay. So which of the following is the best next step in management of this patient? Hormonal therapy, hysterossalpingography, laparoscopy, MRI, or oral contraceptive pills? Um, I really am weak in like any just type of like ovarian tumor or anything like that. Even in a young woman who's like severe pain. Oh, it could just be what's during her menstrual periods and pain during intercourse. My first initial thought with that was going to be like some type of endometriosis, but I don't think it's that. Um, so I don't know. Tender immobile mass in the right adnexal region, complex cystic mass in the right ovary. Maybe I'm wrong. It's like maybe some cystadenoma. I don't know. My guess here, I really don't have a good idea, would be hysterosalping. Maybe just hysterosalpingography. I have no idea. This would be a guess.
Okay. So this one, okay, let's talk about this a little bit first. This is not fair for step two, as you already know. Next step in management, or I mean, for step one, I mean, next step in management is always step two. But like I said, these are somewhat sprinkled throughout this question bank, so don't have to worry about that. But I think you got your diagnosis right, that it's an ovarian mass. Okay, so you have to ask yourself, is this concerning? Yes or no?
I would say I would say usually in a woman who's younger, I would say it's not. If it was an older woman who had like pain during intercourse, I think it would
Well,
be.
sure, sure. So I would say the key thing is the physical exam. If you look at it, it's immobile, so you're worried,
Oh,
right?
that's
Or
yeah, that's not good.
yeah, immobile is never good, right? Also, on top of this, this complex cystic mass of the right ovary, and also is causing your symptoms, right? Pain as well as infertility. So you got to ask yourself, okay, so what do you want to do next, right? So laparoscopy, right? So it could be endometriosis, like you said, like an endometrioma, okay,
Oh
is something
yeah.
that can be, which is a endometrial tissue that has kind of taken over the ovary, right, and caused a cyst, right? And so to diagnose it, you want to do a laparoscopy, right, meaning kind of put little ports in the stomach and kind of take a look around, right? And then obviously you would have to take kind of either biopsies or anything like that. But to be
Okay.
sure of the diagnosis, you got to take a look inside. It's a little bit of a surgical thing. Okay.
Okay. Okay.
But like I said, you're not responsible for this kind of question. But the
Soon
key,
though.
say it again.
Soon though, I will be.
Soon though, exactly, soon though. So that's a good saying for sure, because you're eventually gonna have to know this. But what you need to know for step one for sure is that keep in your mind the diagnosis, right? And kind of the symptomology. But yeah, I think you're on the right track.